really benefit each and every Filipino and especially you I partners who is listening right now. Um, Conventional medicine is still very good. You still need to go to your emergency room for emergency cases, to your specialist if you would like to see the intricacies of different disease pathology within our body. But when it comes to prevention, I really can tell and with conviction that naturopathy, integrative medicine, functional medicine, and even nutritional immunology is the best way to go. And with psychoneuroimmunology, this is a very hot subject. I hope and pray na some of our eye partners could study this amazing discipline and subject within integrative medicine. There's an online course in Australia. It's a little bit affordable. But one of our coaches, our clinic staff, who came to be a psychometrician, a licensed psychometrician, also is also a certified psychoneuroimmunologist. And maybe one of these days, I would like to invite her so that she can discuss some of the basics of psychoneuroimmunology. But for now, let me introduce to you the subject so that in a way we will be more knowledgeable and we can add value, not just for us, but including our family and especially our clients when it comes to IQMK Global. So we start with this slide and okay, psychoneuroimmunology is the study of the interaction. Again, when it comes to integrative medicine, each and every organ, each and every cell, and each and every system is interconnected. Plus my studies about the mind and body connection. PNI or your psychoneuroimmunology is between the psychological processes and the nervous system, immune system, which is highly challenged nowadays because of the post-COVID era, plus the cases, the high rising cases of long COVID 19 cases or your post-viral syndromes. And some of my colleagues within the integrative medicine field, sa tingin nila, it's all about some sort of vaccine injury. But we have the data, and one of our consultant, Dr. Homer Lim, is also an advocate of educating people um, about the long COVID syndrome and also the vaccine adverse reaction. At the end of the day, it's all about our immune system. Pero what I would like to stress and remind everybody today is the connection of the psyche or your mind and emotions when it comes to your immune system, including your nervous system, especially your endocrine. The endocrine system composed of your hormonal organs, for example, your thyroid gland, your um, pancreas, which secretes insulin and glucagon, your adrenal gland, which secretes cortisol, which is your stress hormone, and you have also your thymus gland. For the female, you have the ovaries, and for the male, you have the male hormones and testosterone. So it's very important to incorporate psychology, immunology, physiology, and endocrinology in dealing with infectious diseases, allergy, rheumatology, and molecular biology. So we call this now as PNI for Australia and PENI for this presentation. It's psycho and endoneuroimmunology. So you don't need to be confused, but at the end of the day, I would like to illustrate more when it comes to the subject. But when you search the National Library of Medicine, you just type PubMed, you Google, go to your Google, and there's a very good article coming from the World Allergy Organ Journal, published last 2017. It's entitled Psychoneuroimmunoendocrinology and its clinical implications. So in the near future, doctors will deal and study this very important subject so that we can learn to look at the human health in a bird's eye view. So sa ngayon po kasi it's more of segmental medicine. That's why you have your specialist, which is not bad. That's very good pa rin. Pero there are disease entities, especially right now, after COVID, ang daming allergies, you have your different cancers, your different hormonal problems. Kaya very important po to have another discipline that can look into the interconnections. Like integrative medicine, everything is interconnected. It's your mind, body, and spirituality. But a subject of integrative medicine is your psychoneuroimmunoendocrinology. So this is published by some doctors and meron po sila mga copyright. Pero I would like to share with you the abstract. And I highlighted one of the most important sentence there, that the aim of psychoneuroimmunoendocrinology is to apply medical knowledge to the treatment different allergic, immune, autoimmune disease right now is daming cases, from rheumatoid arthritis to irritable bowel syndrome, your dermatitis, and even blood dysplasia, blood problems. Rheumatic diseases, neoplastic is your cancers, endocrine, cardiovascular, and even dental pathologies are included in this subject. So they studied from 1936 to 2016, and they have the descriptive and experimental studies about the subject. So according to the background, a link between findings from psychiatry, neurology, immunology, and endocrinology has been noted for many years. Maybe it's the first time that you heard about the word PNI or psychoneuroimmunology, but it's been studied for the past years. I think it started last 1975. A group of doctors, including Dr. Adair and Cohen, studied the effects of stress on the immune system. So to simplify things, each and every one of us experience stress, and when we are bombarded by stressors coming from our environment, noise pollution, some of the stressors from electromagnetic radiation, financial stress, and economic challenges, definitely it will affect not just our cardiovascular system, but including our psychological emotional system, including our immune system and our hormonal imbalances. So nowadays you can see different patients, especially for the female, part of the celebration of the Women's Month this March, is hormonal problems among women. Different pathologies like hormonal imbalances and weight gain, some fertility issues. According to the statistics, our fertility rate here in the Philippines is declining. Different breast mass, breast cancer, these are all related to the hormones also. So we really need to deal with this subject about endocrinology and how stress and our psychological emotions can affect these different organs. So we are looking it in a general way, like on a bird's eye view, so that we can interconnect everything. This is a very specific field, but yet it's a generalized knowledge. Okay, and I hope more and more doctors could really learn about this psychoneuroendocrine immunology subject. So neuroimmunophysiologists, these are a group of doctors, have found that stress, anxiety, and depression not only affect the protective function of the immune system, but also alter its regulatory functions. So I would like to remind everybody that our immune system can go two ways. It can go hyperactive, which includes different diseases, kagaya po ng asthma, your dermatitis again, hypersensitivity reactions, your skin asthma. So these are all allergic reactions na nagiging hypersensitive po ang ating immune system. Pag high po naman siya, medyo sluggish or lazy yung ating immune system, then you will have different kinds of infections or even cancer because the immune system is involved in proofreading our DNA and checking out and detoxification of our body. So very important po the word immunomodulation. So at the end of the day, our body together with the immune system, the nervous system, and the endocrine system should balance everything. So that's why when you principle of yin yang, the traditional Chinese medicine, which is all about homeostasis, balance of our system and of our life. So ayan, we have some cases of nervous asthma, neurodermatitis nowadays, and I really remember during my medical clerkship when I am part of the hospital, and we rotated in one department is the dermatology department. We attended a symposium for doctors and different dermatologists. That's way back 2003 or 2004, so medyo matagal na. One thing na I really remembered from one of the best consultant, dermatology consultant, is this: if you cannot find anything within the body, tapos merong rashes, may allergic reactions, one word can explain everything. It's stress. So, kasi po kahit ginagamot na steroids, you're using different medications, but yet the patient cannot improve or do not get well, it's not being cured, you define it as your stressors. And true enough, during my clinical practice, with our technology here in the clinic from Korea, the Max Pulse and the Smart Pulse, we can assess the physical stressors and even the mental stress of the patient, because it can reflect with your HRV, your heart rate variability, which is connected to your sinoatrial node in your heart, connected with your brain. So that's the beauty of having technology to assess patients kung stress nga bang pinagmulan po ng mga different imbalances within the body. Because stress can be, most of the time, tinatanggi natin yan. Ano? Ibig sabihin, um, we mask ourselves na I'm okay, pero tama rin naman sinasabi na it's okay not to be okay. That's why we integrate different counseling protocols, psychometric analysis, and even we teach meditation within our clinic so that the patient can really be equipped to handle different stressful situations, especially nowadays that we are in inflation, we are being challenged economically. Our children are fond of different stimulus from the social media. Kaya po, minsan, sometimes the relationships within the family and the communication ay nagiging problem na rin. So here is a simple diagram that can show you the interconnection of the brain, psychology, the immune system, inflammatory response, and even your hormones. So key factor here is the social stressors, kagaya po ng social evaluation, rejection, isolation, and exclusion. You have isolation during the COVID pandemic. When a patient has COVID, he or she is being isolated in a room. So magkakreate ng stress sa kanyang katawan. And eventually, the brain can release hormones, including the ACTH, adrenocorticotropin hormone, that can stimulate the adrenal gland, the small gland above your kidneys. It's a pair, isa sa kaliwa sa kanan. Then it will secrete glucocorticoids. These are steroids within our body. The sympathetic nervous system will affect each and every organ, including the intestine, the lungs, digestion, and even the immune system. And it will target the individual cells, making it hyperreactive to different stimulus. That's why macrophage, T cells, and natural killer cells, there's a cytokine production. And during a severe COVID attack, and even some infections, not just COVID, even bacterial infections um, can stimulate production of cytokines. So connected po yan, ano? It's interconnected up to the cellular level, including this inflammatory response, kagaya po ng IL-1, IL-6, and TNF-alpha. So molecular level, I wouldn't want akong you to deal with so much into details. Pero what I would like to say is, yan yung mechanism within our body, and it's creating a havoc and imbalances and disorientation of the intelligence of the immune system. Kasi po, we are created to have a very intelligent immunity that can respond to different triggers and stimulus. Kaya lang at the end of the day, kapag may mga novel virus na yan, o sometimes yung chemical or toxicity, plus stressful ang pasyente, it's very hard for a patient to recover from different diseases, and it's very hard for a patient to establish homeostasis or balance. Okay, a little bit of introduction about the autonomic nervous system. It's a division of the peripheral nervous system because the nervous system is divided into two. The central nervous system, which includes your brain and your spinal cord, and your peripheral nervous system, which includes your spinal nerves. The spinal nerves includes the nerves that affects each and every organ within the body. It controls the unconscious or the automatic processes within our body and influences the functions of internal organs. So example of unconscious bodily functions is respiration. Kahit tutulog tayo, we still breathe. Kahit natutulog tayo, may digestion pa rin nangyayari. May circulation pa rin nangyayari. So heart rate, blood pressure, body temperature, electrolyte balance, digestion, respiratory rate, pupillary response, urination, and sexual arousal. Dumadami na pong mga cases ngayon na nawawala yung control din sa pag-ihi. It's part of your autonomic nervous system. Sad to say, there's no doctor who is specialized in autonomic nervous system. The neurologist can help, but the neurologist tackles more of the central nervous system. The neurophysiologist may help. A neurosurgeon might also help. Kaya nga lang po, syempre dahil surgeon po yan, yung processes within our body, ang best na training po for the autonomic nervous system for now, coming from the United States, is your HeartMath Institute. You may enroll also there. You may recommend some of the courses that you can study. May counting presyo, pero at the end of the day, here in the Philippines, we have 3 or 4 consultants, including me, when it comes to the HeartMath Institute. One doctor is from St. Luke's, so it's a very important part of integrative medicine, because now we can see the picture of the holistic approach of the interconnection of different organs within our body. So this is also very important. With autonomic function tests, including our tests in the clinic, the heart rate variability and max pulse and smart pulse test, we can check how well is the immune system, which controls the homeostasis within our body, to protect us from different infections, including viral and fungal and bacterial infections and stress. So the trifecta of nervous system, immune system, and endocrine system should really be in balance. Because if the autonomic nervous system function is deregulated or hindi po siya balanse, walang homeostasis, dominant on all the activity of our life in our inner body processes, wala po yung homeostasis. Yung mga organic activities within our body, including the gastric fluid. Kaya kung daming patient ngayon, they are taking antacids, pero still may acidity pa rin. So lagi ko pong sinasabi, it's not just about your gastrointestinal tract, because there's a second brain within your gastrointestinal system, which we call the enteric nervous system. Connected pa rin po yan sa ating nervous system and even the immune system. So medyo makukulitan kayo sa akin for reiterating the interconnections of each and every system within our body. Pero that's the way it is, and that's the divine design of our human body. A key of immune system is a neurotransmitter that accelerates or restrains the vital activities, hormonal and internal secretion. Sa US po kasi may mga neurophysiologists that really deals with the different neurotransmitters, kagaya ng mga dopamine na yan, acetylcholine, serotonin, your feel-good hormones, and your happy hormones. Connected po yan. Kaya lang if the patient is stressful, experiencing different negative emotions, it can automatically derange the immune system and even the endocrine system. So napansin niyo po, common among female who is not losing weight, hormonal imbalances po yan. Pero look at the core of the problem and you'll see some sort of depression, anxiety, or sometimes frustration. Bakit nag-exercise, hindi pa rin nag-lose ng weight? Bakit nagkakapikos pa rin, maingat sa pagkain? Sort of that examples nakikita natin. Okay, you have the viruses, bacteria, even toxic substances na wala tayong ligtas. We are living a toxic world. Lumabas lang tayo ng bahay, there's pollution coming from vehicles, tricycle, and jeepneys, and even mga malalaking sasakyan, lalo na sa mga factory. So, magkakaroon po ng imbalances within our body, and yung our immunocytes, yung ating mga immune system cells, pag tumaas po yung sympathetic nervous system, which is tension, stress, hihina po lahat yan. There will be derangement and weakening of the different immune warriors within your body. So very important po balance yung sympathetic nervous system and the parasympathetic nervous system, which I will illustrate more sa mga susunod na slide. Okay, part also of the journal that we look is different studies. So we have different references, and they enumerated some of the well-studied journals about the interconnection of the brain, nervous system, and the immune system, and the endocrine system. So in-highlight ko lang po yung one of the conclusion stating that stress is a risk factor for health in all systems of the body. So na yan, it's not just your nervous system, immune system, even your cardiovascular system, your liver, your integumentary system, which includes your skin, activity. Once a limit is exceeded by an intense stressor, the body becomes depleted, posing stress-associated diseases. And we have a table, or we enumerate different diseases that's connected with stress. It's almost everything, every organ. Sa top 10 causes of mortality within the Philippines, ranging from heart disease, cancer, pulmonary problems, kidney problems, all related to stress. One cause of mortality, which is your accident, is not directly related to stress, pero when you come to think about it, some of the road rages, na tipiko ng mga driver, stress pa rin yan eh. Maaring sobrang pagod, maaring galit sa pagtaas ng gasolina, maaring galit sa government siguro because the issue of the jeepney problems. So lahat po yan ay connected sa stress. Kaya it's very important that we remind everybody about the connection and the detailed relationships of how stress can affect our immune system, our nervous system, our endocrine system, and I think every system in our body. The autonomic nervous system reflects your immune system. So we have immunologists, we have infectious disease specialists within our hospitals. But again, no one specializes about the autonomic nervous system. And even me, I do not consider myself as a specialist in the autonomic nervous system. And I don't have plans to be a specialist. My plan is always to be a generalist. So meaning to say, to look at the bigger picture, the bird's eye view, and the interconnection of different systems within our body. When stress, death of immune cells, again, death of immune cells and the imbalance of autonomic nerves occur. This will lead into induced inflammation and cause disease by reducing immune cells. Namamatay, nababawasan, humihina ang ating immune system because of different stressors. Not just your psychological, emotional stress, even your physical stress, which includes your lack of sleep, very important. Kasi nga po, sleep is underrated. Bagamat we have sleep specialist doctors. Makati Med, St. Luke's, we have sleep specialist doctors. These are neurologists which na nag-study talaga tungkol sa details about the pathology ng sleep problems. Pero alam niyo po, one population that I'm looking and I would like to help is our young people, our teenagers, kasi they're really into social media, TikTok, Facebook, sometimes Korean telenovela. That's why most of them sleeps at around 12 midnight hanggang 1, 2 a.m. um, it can really affect the integrity and the intelligence of our immune system. So no wonder bakit marami pong sakit ngayon. Isa po dyan puyat. Exercise, syempre kailangan po natin yan. Sabi po dito, what if all test results are normal? This happens in my clinic from time to time. Normal ang blood chem, normal ang ultrasound, but still the patient feel uncomfortable and tired. Kasi po ngayon, post-COVID era, number one symptom that we should be alarmed is your fatigue. If you feel tired, if you feel unease, or you feel weak, or low bat, or low energy, that's something to do with your autonomic nervous system balance and your immune system. Bago pa lang po dumating yung COVID, even dengue virus, even influenza virus, after the infection, the patient can really experience fatigue. Kasi nga po nagkaroon ng battle, ng war within our bodies sa pamamagitan ng immune warriors, which is your immune system, and yung mga viruses, bacteria na yun na pumapasok sa ating katawan. So para baga nagkaroon, should really recuperate at kailangan po niyang recover. That's why may fatigue. And if you don't have nutrition, if you're constantly tired, and lalo na hindi ka natutulog na maayos, tapos exposed ka pa sa different toxicity, so can really equate into different kinds of diseases. So continuous stress, it will cause autonomic dysfunction. We don't want that disease kasi involved talaga po neurologic deficits dyan, decreased immune system, and different diseases. Okay, so if you can see the lower part of the right side of the slide, stress can affect ANS imbalance, autonomic nervous system imbalance, and later on can weaken your autoimmune function due to cortisol hypersecretion, which organ again secretes cortisol. It's your adrenal gland stimulated by the brain through the ACTH hormone. So hindi naman ganoon kahalaga yan, pero gusto ko lang talaga pong impart sa mga eye partners yung interconnection of everything. Papunta na po tayo sa era ng medicine na hindi na masyado talagang sobrang subspecialized, ano. I hate to say this, pero this is just my opinion, na the doctors of the future should really look into the interconnections. Hindi ko sinasabi yan dahil yan po ang aking forte, pero laging magkakaroon ng missing link. Kasi po sa modern medicine ngayon, there's always a missing link, and there's lots of diseases na walang cure. So yun po ang problem ngayon sa medisina. Libo-libong sakit na po ang wala na pong cure. Kaya nga lang, maaring kulang po yung diagnostic siguro. Baka hindi po natitignan yung immune system. Baka po hindi nakikita yung interconnection ng nervous system, immune system, and the endocrine system. So kasi po sa nervous system, syempre, neurologist nga ang specialist dyan. Immune system, yung infectious doctor. And sa endocrine naman, your endocrinologist. So it's very rare for a Filipino patient, 3 doctors. Kaya po sa clinic namin, we try our best. I try my best to interconnect these systems so that we can come up with a better treatment plan, saka kasama na rin po yung diagnosis. Okay, I would like to insert one subject article published from the Neurology and Clinical Neuroscience Journal. It's how COVID-19 can cause autonomic dysfunction and postural yes. A review of mechanism and evidence. So yan po ang title ng ating journal. At ito po yung part ng journal na diagram. Hindi ko po isa-isahin, pero I would like to reiterate that when the infection pumasok siya sa atin, kahit po wala ng symptoms, halimbawa 2020 o 2021 pa tayo nagka-infection, pwede pa rin po mag-cause, especially po yung mga ICU, yung mga severe COVID, pwede pa rin po magkaroon siya ng mga post-infectious symptoms. Kasi nga po, ito po mga pag pumasok, yan yung headache, yung dizziness, pero habang tumatagal po, pwede po mag-cause ng imbalance sa nervous system, and pwede po mag-cause ng mga myocarditis, heart arrhythmia, immune system dysfunction. One population here in our province, in our town, Louisiana, Laguna, we have a tourist spot here called Hulugan Falls. And there are 100, I think, tour guides, local tour guides within the community. Na they are very strong. They can go up and down within the falls. May dala-dala pa sila mga gamit and mga bitbit. Kasi nga po tour guide eh. It's their bread and butter. Pero when the LGU decided to require these tour guides to have their vaccine and initial vaccine and boosters, one or two boosters, that's the time that these tour guides experience easy fatigability, mas madali sila mapagod. Most of them sinisipon na at para may allergic reactions. So we cannot think of any reason or cause kung bakit po nangyari yon. I would like to think na baka may dating infection, pero that 100 people, ganun kadaming tao, hindi po lahat yan nagkaroon ng infection. Yung iba dyan, hindi sinisipon, hindi sinuubo. Pero ito na nga po, nagkaroon po ng mga boosters na yan. Don't get me wrong, I'm not against that strategy of the government. Pero I met one very good scientist in the name of Dr. Oclarit. Baka kilala niyo po siya. He's one of the celebrated scientists here in the Philippines from Cebu na talagang alam niya po yung mga vaccines niya. Personally, sabi niya po sa akin, he do not think na gano'n kabilis dapat magkaroon ng mga vaccines. Ako naman po, I appreciate na maluwag tayo ngayon, we can celebrate, we can papasok tayo sa mga malls. Kaya nga lang po, mayroon din akong question din when it comes to the handling of our vaccines. Kasi po, sabi ng brother ko from US, nagpunta rin siya ng France, talaga nasa mga refrigerator yan at well handled ng facility. Nagtataka lang po ako dito sa amin kasi nasa mga barangay, at wala naman ako nakitang mga cooler man lang o lalagyan. So I don't know these are just purely my opinion. Wag niyo na po siyang quote and quote. This is just a sharing because I love our eye partners so that kahit papaano po ay meron kayong ibang angle ng knowledge and wisdom when it comes to medicine. Pero you still balance everything, You can use your intuition, you can pray for it. If ito pong Guillain-Barré syndrome, your GBS, wala po dito sa amin yan, sa cases naman yan. Pero I've met 3 cases now diagnosed with GBS. Talaga po na-paralyze sila, hindi sila nakalakad. And when you go to the medical literature, most of the cases of GBS came from viral infection. So yan po ang problema natin. The latest study po ngayon, hindi na po cardiovascular at tinatamaan ng different infection, kundi yung nervous system na. Kaya dumadami pong stroke ngayon, dumadami po ngayon ang Parkinson's, dumadami po ngayon ang Alzheimer's, and even cognitive dysfunctions. Ibig sabihin po ng cognitive dysfunctions, yung mga mahirap kausap, mahina yung memory, walang presence of mind. Some of our young people, meron ganyan eh. So yan po ang problem ngayon. At some scientists, they think na mukhang may connection pa rin po yan sa mga infection na nangyari noong 2020, 2021, and last year. So, it's not my intention na mag-inject ng fear sa inyong lahat. Pero, nakakatulong kasi talaga po yung product natin. Diyan papasok po yung solution that we have on hand na makakatulong sa maraming Pilipino when it comes to prevention. Although, alam natin for sure na yung resveratrol, active compound ng ating Muscadine products, including the quercetin, can really help. Para sa akin po, these are also therapeutic when it comes to our clinic. Natural based nga lang talaga siya. Okay, so much of this infographic kasi po medyo komplikado. Again, a journal na naman kasi po we need to deal with the evidences. So ang good news po, there's a study sa website ng Molecules, the role of resveratrol in prevention and control of cardiovascular disorders and cardiovascular complications related to COVID-19. So this is your long COVID, your post-COVID exertional malaise, at saka po yung bioavailability to saka yung mode of action. This is a very recent article, that's March 15, 2021. So ito po naman yung laman ng infographic. Mas kinapture ko na lang po yung infographic para kahit pa paano medyo visual po sa ating lahat. Kaysa naman isa-isahin ko po yung words dun sa journal. Pero makakatulong po ang resveratrol sa vascular endothelial dysfunction. Ibig sabihin yung muscarine products natin can really help sa blood flow, sa inflammation, sa pamamaga ng arteries, sa cytokine storm, which is your hypersensitivity ng ating immune system, sa impaired immune cell cytotoxicity, sa thrombotic events, kaya po ang daming heart attacks sa stroke ngayon. Pero if you're taking our muscadine products, if you are eating our muscadine products, you have a greater chance and better peace of mind, ano, para po hindi tayo magkaroon ng karamdaman o sakit. Especially for us dealing with patients, day to day may mga umuubo pa rin po dyan. Meron pa rin mga infectious na mga pasyente. Um, my peace of mind is taking our muscadine products para po hindi tayo mahawa at hindi tayo magkasakit. And awa ng Diyos, ano po, for the past years, nagte-take po ako nito, hindi ako nagkakasakit. Yan ang number one gift check of the heart na meron ako niyan. Aside from I really benefit when I recommend it to my patients. So another, resveratrol and quercetin also included in our products. We just look na lang po sa blood. It prevents apoptosis. Hindi natin isa-isahin na po, pero immune system, liver, yung effect niya sa brain, ano? It abrogates depression, it prevents neuronal damage, improves cognitive dysfunction. So if you meet a family member or a friend na parang lutang, ang hirap kausap, ang bagal ng response. Hindi ko alam kung may neuronal problems na yan, pero you can really recommend our muscadine products as low dose, as 1 capsule 3 times a day. Pero kung nag-improve na siya at medyo na-try na niya, maganda yung effect sa kanya, you can increase the dose of 2 capsules 3 times a day. Pwera lang kung mga matitinding cases of cancer, that's the time that we double or triple the doses. Ang dami ko palang mga evidence dito, no? Hopefully na hindi kayo masyado na bored, pero siguro last na ito. Resveratrol and antioxidant and neuroprotective actions. I've stated earlier, nowadays, nervous system po ang tinatamaan ngayon. Siguro kasama na rin dyan yung puyat, MSG, too much sugar sa ating pagkain, too much radiation. Pero meron kaming hinala na yung nervous system, kasi nga immune system tinatamaan. Kaya po nagkakaroon ng mga GBS na yan, Guillain-Barré syndrome, nagkakaroon po ng mga puro inflammation po yung pinagmumulan. So, very good news po, our muscadine, maraming resveratrol, quercetin, anti-inflammatory compounds, high dose of vitamin C and fiber. Kaya ang laking tulong po niya. No? I call the muscadine products compared to other supplements, it's unadulterated. Ibig sabihin po, sa pinakang natural form po niya. Kasi po di natin makakain yung mismong grapes, pero sa pinakang natural form. Kasi po, I'm really not a fan of formulated supplements, yung mga halo-halo, mga 100 in 1 again. I do not like that. No? Kasi una-una po, adulterated nga siya. So, better if you can have the supplement or the muscadine in its purest form. And with the track record of our company, IQMK, plus the effect these products to my patients and to me, I can really say that na-preserve talaga po. Na-preserve through science and technology yung goodness and benefits po ng ating product. Highlights central nervous system, damage ng oxidative stress, natural polyphenols, which is very abundant sa ating muscadine grapes, antioxidants, and neurological recovery. So kasi nowadays, especially hardcore neurologists, they will not recommend resveratrol or polyphenols. Siguro mag-recommend sila ng mga clopidogrel, blood thinner, aspirin, neuroprotectant. They are using also gabapentin. So mga medications talaga po yan eh. Pero ang beauty po, when a patient comes to me, at prescribe po siya ng mga synthetic drugs na yan, hindi ko po inaalis, pinapatuloy ko lang. Then I will add. So sabi ko nga po, complementary, integrated. So ibig sabihin, sabay muna sila. No? Pero the patient can really tell the difference. when it comes to energy, when it comes to uh, better sleep. And we all experience that here in our company, especially if we take our products regularly. Okay, again, my favorite slide because we have the science here. We have some claims, pero better word siguro, before each number is the word help. Talaga natin mag-help yan. Because we also do not want to hype our products too much and claim mga false claims na eventually hindi naman agad mararamdaman ng mga pasyente. Pero different patients will have different experiences with our product. Ako talaga po, first day ko nga po siya, first day ko siya, that's only one capsule, ramdam ko na yan. Kasi very sensitive po yung gut ko dyan, saka po yung aking immunity. Pero kung ang patient po ay may IBS or irritable bowel syndrome or inflammatory bowel disease, hindi agad-agad i-correct po muna yung inflammation bago mo pa maramdaman yung mga benefits sa neuroendocrine at saka sa psychoneuroimmunology functions. Pero lahat pong enumerated na yan, as per my experience and my belief, lahat po yan ay totoo. Even cholesterol levels, yun na nga lang talaga po naging problem ko sa clinic. I failed to document, pero we have an online platform na pinapa-upload ko na ng sa aking mga nurses yung mga different blood results so that I can really show you more about the beauty and efficacy of our products. Pero lahat po yan totoo. Energy, anti-inflammatory, anti-cancer property, it really helps a lot. So again, kwento ko sa inyo about our smart posters, a small gadget na parang lang po siyang pulse oximeter that can estimate the autonomic nervous system function ng patient saka po yung blood circulation niya. Ganito po ang result niya, and I would like to share with you one patient, a 42-year-old female. You just look at the left side of your screen. Yan po yung unang test niya last July 10 at around 12, oras to 80, around 6:15 in the afternoon. And then I repeated the test at 7 o'clock, past 7. So ilang minutes lang po. So ang titignan po natin dito is the stress info on the left side. Ang taas po ng physical stress ng patient is 98. The normal value here is 50. The patient complains ng fatigue, headache. Saka po that time medyo mataas yung blood pressure niya. Nagkakamali, mga 140/90. Pero sanay po siya ng 120/80. Mental stress, mataas din po, 72. Your normal value is 50. And her overall stress score is 82. Normal natin 50 lang. Ito na po yung sinasabi kong autonomic nervous system balance. Ang dapat na normal po dyan, yung white bar na ito should be in the middle. So meron po siyang sympathetic nervous system dominance. And when it comes to sympathetic nervous system, this is your fight or flight. Kaya po sobrang pagod ng pasyente, uneasy siya, restless, and medyo irritable. I know this patient kasi po would like to divulge, wife ko po yan. Hindi ko na lang nalagay yung name niya. Pero wife ko po yan. Ang init ng ulo niya. Hindi lang sa akin, kaya sa kanya mga anak. And when we look the stress resilience, 14 lang. So it's poor. Dapat po yan 50 pataas. So that's the magic number. Tapos yung blood circulation naman, okay naman po, type 2. Pero meron nagsisimula pong 41% na type 3, which is your atherosclerosis. Kasi medyo nakakain yata siya ng oily food. So, nung dumating siya ng mga symptoms na ito, nasa akin pa sa table ko yung 1 bottle of Muscadine. Bigyan ko lang po siya ng 2 capsules. Capsules lang. Kasi ubos na yung coffee na pinadala sa akin, yung 2 capsules ng Muscadine. So ito po, you look at the results a few minutes from the first result, yung 98 stress score niya naging 28. So bumaba po siya ng 70 points. Mental stress niya na 72, naging 12 na lang. Yung kanyang overall stress score na 82, naging 44. So normal na po yan. Pumalo muna po sa parasympathetic nervous system yung kanyang I-bar, yung kanyang kulay white na result. Kasi po ang parasympathetic nervous system is your repair and regeneration. So that's your rest and digest. So SNS is sympathetic nervous system, that's fight or flight. Kapag bumaba po yan ng TNS, rest and digest, that's where healing occurs. Yan po napupunta yung pagpapagaling. Tapos pansinin niyo po yung kanyang stress resilience which equates to her heart rate variability, yung kanyang tinatawag na autonomic nervous system function. Yung 14 po niya, tumaas po ng normal, which is good, na naging 81. With just a few minutes taking our Muscadine products. So, what's my conclusion? Stories will sell, but numbers don't lie. So that's why my conviction in recommending our products, because my family members and including me, especially my wife, talagang nakita niyo po yung mabilis niyang effect. Hindi po yan magagawa ng vitamins, supplements, or no approved therapeutic claims, although we have there with our bottle. Pero a nutraceutical, an invention from God, a natural product, loaded with phytochemicals that can balance our system and improve our immune system, nervous system, and even our psychoneuroimmunology. Ayan po yung nagagawa po ng muscadine. So it's not just the improving the immune system or fiber or vitamin C or nutrition. Hindi po siya ganoon lang ang muscadine. So I go along and I prescribe it to my patients. I'm continuously discovering na talaga pong effective siya. Very effective, I may say. So ayan po, I think that's my last slide. That's the result of my wife way back at July of this year. And from there on, everyday na po siya nag-take ng muscadine. Some of my supplies sa kanya ko lang binibigay. Kasi po, ako okay naman ako eh. Kaya lang, basta Women's Month kayo. And we need to take care of our wife. Saka, mga babae. Alam niyo kung bakit? I was invited last week to talk about yung anger management. I may say, minsan kaya nagkakasakit po ang mga babae, especially yung mga kagaya ng wife ko nga. Kasi nga, kami mga lalaki kasi at trabaho lang, uuwi sa bahay, wala nang gagawin. Diba ang babae, wala pong expiration ng trabaho, na dire-diretso yun hanggang pagtanda, 24 hours a day. Plus siguro may effect din talaga po yung psychological, emotional stress. Kasi nasa mga babae, hindi ko naman sinasabing sa babae lang, pero yung mga repressed anger, yung mga irritability na yan from Kaya po, kung meron mang mister or kalalaki na nakikinig sa akin, mas unawain natin kasi po may prone sila sa mga hormonal imbalances and sometimes ang repressed anger. Kaya po constant communication talaga. And pinakamaganda, matest din po sana natin. And I hope and pray na ma-bless ako ng time so that I can visit our office. And if free natin itong test na to, yung Smart Pulse, although I charge sa my clinic na 250 pesos per test. Pero as an offer, as a friendship offer sa aking mga eye partners, I would offer it for free, together with my consultants, my coaches, saka yung mga nurses namin sa clinic. I have 5 units kaya po I can test around 100 people, half for a day. Yan, magagawa po natin yan and sana po, sana ma-schedule ko agad. Ngayon nga lang talaga po, ang nahihirapan ako sa pag-schedule kasi po ang daming pasyente. Kaya mukhang tumatama yung hinala namin sa integrated medicine na challenge talaga ang immune system natin ngayon. Post-COVID era po tayo ngayon and may mga lumalabas pang ibang mga viruses na nababalitaan ko. May mga fungal infection pa, may mga ang dami po dyan. You expect a lot of it sa mga susunod na taon. Kaya we are very blessed, eye partners, to have a gift from God, which is science-based, evidence-based, and it's truly effective. So again, kahit po ilang seminar pa ang gawin natin dyan, if we cannot motivate or encourage our patients or family members to take it, they will not experience it, hindi rin nila maintindihan. Pero makakatulong marahil itong mga binibigay nating values, at saka yung mga fact, mga pag-aaral, mga studies, para kahit pa paano po ay naintindihan nila kung yung science behind these products. So thank you very much for your time and I'm open for some of your questions para kahit pa paano po ay matalakay natin sa hapon na ito. Para win-win tayo lahat sa mga oras natin. Thank you very much. God bless us all.
Thank you, Doc. So another topic was discussed by our very own Doc Rob. and it's all about brain. So we're going to proceed to our question and answer po. Anyone po would like to ask question, can talk about brain, or something that you feel like for example headache, or you have migraine, or anything that is unusual to you na gusto niyo i-clarify kay Doc, which is related to your brain. Well, Doc, meron nung nag-send ng message dito, question from Sir Eric, though it's
Okay,
not
sir. Okay, boss.
related to our topic about liver.
Okay,
So
no
yun,
problem
sabi
po.
lang.
No problem. Sige po.
So, Doc Navalta, good afternoon. In behalf po ng isang eye partner ko, unfortunately, wala pong sa Zoom, but she has a question. I-experience po kasi na uminom ng madaming capsule per day ng isang food supplement sa Australia. Ang capsule na naging elevated liver niya. So, ang ating capsule po pwedeng mag-cause ng highly elevated liver din po daw. So, Doc, nag-cause ng highly elevated yung ininom na isang eye partner
Yes,
na
you're not aware of that
supplement.
supplement, ano? Mhm.
So,
Okay, thank you
tinatanong
for
niya
that question, ano po.
yes sir, ay Doc,
Yes, ano po.
yung sa atin naman Doc na supplement.
Okay.
May tendency pa yung cause ng highly elevated sa liver.
Okay. Some supplements po, here's the answer, no? Some supplements can really cause that, ano? Kasi po, sabi ko nga sa inyo, unadulterated sila. Ibig sabihin, ang daming inihalo, ang daming mga, kung ano, mga preservatives. Kaya ako, I believe some supplements talaga can cause diseases. See, it's not regulated by the government. I'm not sure sa Australia. Pero, speaking for IQMK and my experience for the past more than 2 years, wala po ako nakitang ganyan. Ano po. Kabaliktaran po ang nakita ko. Yung SGPT, normal, bumaba. So wala pong ganyang case sa clinic namin for our 5 clinics at sa hundreds of patients ko na rin po na rekomendahan ng Muscadine products. Sa explanation po, sabi ko nga po sa inyo, in its purest form, it's highly natural and organic. Kaya po hindi siya magkakaroon ng mga ganong effect. Ano. Pero na lang siguro, ano po, ito po ay hypothetical, I'm not sure. Ano. Pero po kung talagang meron ng liver problem yung pasyente. Kasi po, I have one topic about healing crisis sa IQMK. Pwede ko pong balikan yung topic niyan sa susunod na Saturdays kung available tayo. Part po kasi ng detoxification, ang liver kasi parang garbage collector. No? It will collect all the toxins within our body. Meron pong cases, pwede po magkaroon ng case, ano? Pero hindi pa namin nakita sa clinic, na maaring sa first 1 or 2 months ng taking high dose of muscadine products, pwede pong dumami yung pagtaas ng liver enzymes. Ano? Meaning to say, naging active po yung liver kasi po na-stimulate, na-activate po yung detoxification process. Kasi po ganyan ang ginagawa ng ating body. I would like to pertain it directly na yung katawan natin ang gumagawa niyan, pero with the right nutrition, with the diet, with the right nutraceuticals, and phytochemicals, maayos kasi po yung tamang detoxification process ng katawan. Kaya po initially, temporarily, pwedeng mangyari. Pero alam niyo po, just to be safe, pinakamaganda po, you have the basic test ng SGPT or SGOT. Pinakaganda, meron din cool abdominal ultrasound to check before taking our products. Lalo na kung may history. Kasi po, we don't want to have problems na bakit yung Muscadine ang nag-cause yan. Pero again, as per my experience for the past 2 years with more than hundreds of patients, ay wala man ako nakita kung ganyang case. Nakapagbigay na po kasi ako ng 20 capsules per day. Minomonitor ko po yung liver enzymes nila. Wala pong tumaas. Kasi ang normal levels po niyan is around 40, 41. Nagkaroon ako ng patient po na 95 ang kanyang liver enzymes. She's a teenager na mahilig sa mga milk tea. Alam po, bigyan ko kayo ng tip. Ng mga milk tea na yan, sana wala kayong business na milk tea. Siguro gagawa ng sugar, saka po yung mga tapioca pearl yata yan. Pwede po mag-cause ng fatty liver yan. Kasi po itong patient ko na teenager, business niya yung milk tea. Siguro pag hindi naubos, iniinom niya. I'm not sure. Pero umabot po ng 90 plus yung kanyang liver enzymes. Alam niyo po, 1 month ko lang pinababa, 1 capsule 3 times a day lang po ng muscadine. Bumaba po siya ng 32 after 1 month. So wala akong nakitang pagtaas, bumaba po siya. Ang maaaring magpataas po niyan ay sugar, preservatives, toxicity, uh, and even medications, kagaya pa ng mga statin drugs, kagaya ng mga simvastatin na yan, lalo na mga pain relievers. Okay, so the short answer there is, I don't think so, based on my experience. Thank you po for that question. That's a very good question. Kasi pwedeng mangyari talaga, pero kung mangyari man po yan, it's part of the healing crisis and the detoxification process of the body. Thank you very much po.
Okay, thank you, Doc. Sir Eric, if you were able to hear Doc, yun po, yung sagot ni Doc, basically wala pa po na-experience na nagkaroon ng highly elevated sa liver nung umiinom ng ating mas natural capsule. And then, Doc, may follow-up question si Sir Eric.
Sir Eric, is this
Doc,
the same patient po ba? Is this the same patient, si yung may cancer survivor?
yes, Sir
O
Eric.
ito
Same
pang
patient
pasyente
po
siya?
daw po.
Same po, okay. No wonder na po. Kasi po, pero nag-chemotherapy kaya po siya? Kasi po ang chemo, nakakataas po ng liver enzymes yun eh. Pero I cannot say kung ano pong supplement ka. Hindi siya masasabi. Kaya, teka po, unahin natin kay Sir Eric. Nababasa ko po yung GC naman eh. Sa bukol po, we may start, the patient may start taking or eating our muscadine products. The capsule one, pwede rin po yung liquid para mas mabilis. Pero mas kabisado ko po yung capsule. You can start with 1 capsule 3 times a day. After 2 weeks, komportable yung pasyente. She is feeling well. 2 capsules 3 times a day na po yan. May mga patients po na 1 capsule 3 times a day pa rin, lumiliit na yung bukol. Pero I highly recommend to monitor some of the tumor markers, kagaya po ng uh, mga CA125, ano po, mga C-reactive proteins, mga inflammatory markers. Kung wala naman po, ang chest x-ray makakatulong po yan. Pero if you can forward to me yung mga results niya, mas maganda. Pero ang laking tulong po as a complement and integrative approach sa pagpapagaling yung ating mga muscadine products. So thank you, Sir Eric. I hope na matulungan natin yung patient na yan. Pero ang cancer survivor po kasi bihira na ngayon. Ano po? Ibig sabihin, maaring ang cancer tumatahimik lang, pero pag hindi po nagamot yung root cause, it can still manifest in another part of the body. Kaya po yung acidity, toxicity, stress, lahat po yan mga root causes ng sakit eh. Mineral deficiencies, vitamin deficiencies, immune dysfunction, kailangan po ma-correct lahat yan for that patient. Kasi po cancer can still manifest kung nandyan po yung mga root causes na yan. Pero you can't be wrong recommending our products. That's 1 capsule to 3 times a day, then 2 capsules 3 times a day, as high as 10 capsules to 20 capsules po pwede po yan. So thank you, Sir Eric. God bless po. Basahin ko na rin, sir, yung kay Ma'am Maribeth. Can it also help goiter patients? Yes, meron po kang isang pasyente yan. Ang bilis lang ng goiter. Kaya lang, marami pong klase ng goiter. We do not want to oversimplify things. Pero pwede kasing may goiter, pero normal ang mga T3, T4, TSH, pwedeng hindi hypo, basta may bukol lang siya. Ang malaking connection po sa goiter is your digestive system. That's why we highly recommend to have colon detox, with fiber, fruits and vegetables, and water, and stay away from red meat, saka po mga processed foods, especially po mga trans foods. Then you can start with 1 capsule 3 times a day. After 2 weeks, 2 capsules 3 times a day. Yan na po ang ginagawa kong protocol sa clinic para lang po hindi mabigla yung pasyente, unang-una sa gastos, pangalawa, para makapag-adapt muna siya sa a lower dose. Pero ibang usapan po kung ang pasyente po ay cancer na at near-death experience na, definitely talagang sumusugal po tayo dyan sa mas matataas na dosaging. Pero kung nakapag-take ng ilang supplements, tapos gusto nilang malaman kung talagang muscadine ang nakatulong po sa kanya, we highly recommend to stop some of the supplements, then i-take po yung muscadine. Pero kung gamot po yan na butika at prescribed ng doctor, I do not recommend na ititigil po siya. Pero sa experience po sa clinic, the attending physician is the one who lower the dosage of the medications, and tinutuloy lang po namin yung mga products ng muscadine. Okay, thank you Ma'am Maribeth for your question. Di po siya nagpa-chemo. For a complete recommendation, Sir Eric, I would like to look at the latest blood results, para kahit pa paano I can recommend. Pero you can the patient can start taking Muscadine products, 1 capsule 3 times a day, uh, as sort of general wellness protocol. Pero kung may mga results na po, please forward it to me. Pwede po sa aking Facebook account. Yun nga lang po, I'm very sorry, hindi ko na ma-accept yung aking friends. Pero I have a page sa, kasi napuno na po eh. That's 5,000 friends, mga patients ko po yun eh. Pero sa aking page, you can also message me at Robert Navalta Facebook account. Gumagawa na nga rin po akong TikTok para makasagot ako sa mga pasyente. Kaya lang, I don't have the luxury of time to answer it. Siguro makakuha ko ng secretary sa social media siguro. From Ma'am Mary Gale, sa GERD po, di po makulunok ng normal pag kumakain para bumabalik po siya. You can open the capsule po, ihalo niyo po sa water, kutsarahin niyo po yan, pwede. Or yet, we have the liquid form, yung drops po. Pwede naman po yan. There's always a way so that you can introduce Muscadine products sa ating sistema. Pero kaya nabanggit ko kanina, ang GERD po is related sa neuro, sa psychoneuro. So tignan din kung may pagkakataon kung stress ang pasyente, and maybe meditation can really help na makapag-cope up siya sa iba't different stressors emotionally. Maraming salamat, Sir Eric. Thank you very much. Nice meeting you. Kahit po dito sa chat, or you can message mo rin po sa aking Facebook account. Thank you very much din po, Ma'am Maribel. Thank you very much for your time. Okay, maraming salamat po. You have questions po? Para kahit pa paano, salamat po IQMK, kahit pa paano po, may time naman tayong to do this session. Would like to invite, last week si Doc Kate po, she's a naturopathic doctor, na medical technologist, licensed medical technologist po yan. Pero ang forte po niya is nutritional immunology. Ginagamit din po niya yung IQMK products for her patients. Siya naman, live blood analysis. Kitang-kita po sa dugo ngayon at bibigyan ko kayo ng tip. Ang bad news, ang dami po namin nakikita mga toxic heavy metals sa blood ngayon. Not sure kung related sa vaccine, baka pollution pa rin. Kaya nga lang pala isipan sa amin kasi before the pandemic, hindi naman namin nakikita yan. So, sana mali kami na hindi ito vaccine injuries, pero ranging from cardiovascular disease, myocarditis, neurologic deficits, hanggang sa mga challenges ng immune system. Pero we have one document, medyo marami na pala po. Pero may documentation kami of one patient, meron siyang psoriasis dati, napagaling na namin sa clinic, gumaling na po yung pasyente. 2018 ko siya pasyente. Then last month, bumalik po sa akin. Nakadalawang booster na daw siya I forgot the vaccine. Pero ang hinala niya, kasi po alam niyo po ang pasyente, meron siyang gut feeling meron siyang pakiramdam. 1 week after her second dose of booster, naglabas na naman po yung psoriasis niya. Yan ang nakakalungkot. So yun po, na-check namin sa live blood analysis, nutritional microscopy, talaga may mga toxic heavy metals sa blood. Not sure pa rin kung galing sa vaccine kasi po smoker yung kanyang husband. Tapos po may pollution din sa kanyang environment. Pero these are evidences na talagang toxic yung ating paligid. That's why we really need detoxification, and we really need to eat our Muscadine products regularly. Kasi po yung sort of peace of mind and protection yan sa ating family at saka sa ating sarili. Especially kung you are a breadwinner. Lalo na kung lalaki o babae na breadwinner sa family, kailangan ingatan po yan. Ang mga sakit po ngayon, parang bigla, pero we understand, wala namang sakit na bigla It's an accumulation of toxicity, nutritional deficiencies, imbalances. Kaya lang na-trigger talaga po nowadays. Yan ang mga initial findings namin sa clinic. Patient nowadays, mahina ang immune system, hypersensitive, ang daming deficiencies, mineral deficiencies, ang daming pasyenteng stress, ang daming pasyenteng imbalance ang nervous system. Ang mabigat po nito, typical Filipino trait, dahil nga resilient tayo, most of the time, tinatanggi natin. Yan po ang hindi magandang, ang tawag ko po dyan, toxic positivity. Ayaw natin po yan. Kasi nga po hindi natin ugali, syempre manghihinayang pumunta sa doktor, ako okay pa ako, kaya ko pa yan. Tapos kung lumala po yung sakit, emergency room na. Mas malaking problema po yan kung pag-iisipan nyo talaga mas mura pa rin talaga pong prevention. Mas mabigat pong ma-confine, ma-dialysis, ma-operahan, ma-stroke, mas mabigat po yan. Kaya ano ang mas convenient? Paraan, you take everyday our Muscadine products. Ano po? Peace of mind, convenience, yung sasabi ko po, cost effectiveness. Kung totoong kuripot ka at frugal ka, you take our products. Ano po? Iba po ako mag-isip alam ko po yan. Kaya po, estimate lang supplements, nutraceuticals na tinitake ko kasama ng Muscadine. Salamat na lang po sa ating corporate, sa IQMK, at nabibiyayaan po tayo ng Muscadine products. Pero sa mga binibili ko po, it cost me around, for me lang po around 20 to 30K yan. Ang mga tinitake ko po for deficiencies, for immune booster, for my mental clarity, for my sleep. Kasi wala naman pong supplement na cure all Wala naman ganun. Although ang kagandahan po ng Muscadine, wide ang kanyang therapeutic range. Ano po? Ibig sabihin, marami siyang dala. Ayan, sa litong kanto po yan, maraming dala. Wala namang ganong supplement na kayang gamutin lahat or ayusin lahat. Pero ang dami niyang specialty, kagaya po ng cardiovascular, kagaya ng respiratory, ng nervous system, kasama pong endocrinology. Yan po yung magagawa niya, saka immune system. Bali 5 ang tingin kong porte at kagandahan po ng ating Muscadine products. So do you have questions po? May questions pa po kayo, dear iPartners? I hope na maikwento nyo ito, mga pinag-usapan natin. You can really have my slides din. Pwede ko yung padala po yung USB ko, padala ko sa office. Pero ano po, ang goal ko talaga po makapunta sa office. Ano? May schedule ko po yan 1 month in advance so that I can meet and greet you at kahit pa paano po. Na-miss ko nga po yung anniversary natin. It's a real, nakakalungkot yun, pero I'll do my best para maayos ito. Ito kasi yung lugar po namin, Luisiana, Laguna, is near Lucban, Quezon. It's around 4 to 5 hours na travel towards Manila. Kaya po nasa bundok talaga ako technically. Pero sabihin na nila kung gusto may paraan, paggawa naman tayo ng solution. Okay, thank you po. Thank you very much. If you don't, kung may question pa po kayo, please feel free.
Yes, Doc. So sana talaga mapasok ka dito sa office and
Oo nga, sir.
one of our activities.
Para
Doc,
bumanding
kami
man
ng mga
tayo.
Yes, Doc. Kasi nagmumukha ka ng artista, Doc. Kasi dito ka namin nakita online. Nagmumukha ng celebrity. Although itsura mo talaga, sir, mukhang celebrity. Pero ng celebrity dahil hanggang online ka lang namin nakita. Kaya sana, Doc, face-to-face na mamit ka namin para mapagpa-autograph kami.
Sige po. I bring my team, ano po. You can invite patients po or your loved ones. Ano po, schedule natin na. Ano ba ngayon, March? Tingnan natin po, baka may sangat natin this March. Preferably, it's a Wednesday. Kasi po yung family time ko po Pero I can sacrifice some of my family time. Or Saturday na.
Saturday. Yes, Doc. Saturday.
Saturday po siguro afternoon po yan. After my clinic sa Lucena. Po ako dyan. Schedule ko po. Sige, check my schedule. Baka sir may activity din na parang 2-in-1, maka-insert ako ng kaunti para po may marketing or ano po campaign, then para po mas marami, mas ma-maximize natin yung time.
Actually,
Yung
Doc,
test
may
naman po natin sa
pinaplano kami
smartphones,
nila,
that's
sir.
1 minute lang. Yes sir.
Yes, Doc, may pinaplano kami ni Sir Mike. So hopefully maging okay po at
Siguro mga 2 or 3 weeks advance lang sir para ma-schedule ko agad.
Yes, Doc, kasi gusto ni Sir Mike talagang mas mapalawak or mas marinig yung boss mo dahil sayang po, Doc. Gusto ni Sir Mike mas marinig ka po yung boss mo sa mas maraming part ng Pilipinas. And overseas pa nga po, Doc, ang gusto ni Sir Mike. So gusto niya i-promote talaga for overseas. US.
One of the reason po kaya yung narinig nyo last week si Doc Kate, mentor ko.
From our partners po, any question pa po kay Doc? Kahit po hindi related sa brain since medyo tingin ko po mas maraming issue with regards to liver, blood, and some other else po.
Yung connection po, very important.
Yes, Doc. Tapos kung brain po siguro, talagang mas critical yun. So kung meron na po kayo nararamdaman na kakaiba,
brain fog po, huwag niyong babaliwalain yung brain fog. Naku, yan po ay isa sa pinakang, yan dyan na magsisimula yan, yung mga brain fog na yan. And I'm seeing it sa mga young people. Ang dami na pong ganyan. Dati-dati nga po, I can memorize different lyrics ng songs. Nowadays, ang mga kabataan po natin, hindi makapag-memorize, nakadepende sa cellphone, memorizing their songs. Ano? And isa po yan sa mga problem natin yan, brain fog. Siguro po overstimulation, siguro social media, Korean telenovela. Hindi ako against dyan, pero please limit it. At least tell your kids, ano, especially mga teenagers, na to balance it everything. You know? Balance yung bagay na yan. At saka pinakamaganda, take our products. Kung talagang hindi nyo madisiplina, take our products. Yun naman malaking bagay. Thank you po sa inyo lahat. Maraming salamat.
Yes, Doc. Tama. Take our product every day para po talagang meron tayong ginagawang pangontra, kumbaga, sa mga hindi natin mapigilan na nagkakos ng toxicity sa katawan or inflammation. So,
Yes, sir.
from Ma'am Maribet, actually, may time one attendee tayo. So, hanggang Taiwan po pala, Doc. Nakakarating na yung test forum natin. So, good to know, Ma'am Maribet. To Miss Anne. Hopefully, sa mga ibang taga-Taiwan, nasa Taiwan po, ng mga kababayan po natin, sana mas lumawak para po, yun, makatulong sa kanila since hindi sila makakauwi agad ng Pilipinas para mapagpa-check up sa sarili nating doktor or Filipino doctors. So, with the help of Doc Robert and Health Forum by IKMK, sana po makatulong. Yes, Ma'am Maribel. So, anyone else po who would like to ask question kay Doc Rob? Sa tingin ko, Doc, okay na sila.
Thank you po. Maraming salamat.
Yes, we have our Iloilo po, Sir Eric, no? Headed by our business center operator, Ma'am Cynthia. Ma'am Cynthia, how are you po?
Hi, ma'am.
So, yun, Doc. Yes. So, Doc, sa tingin ko, next Saturday, we're going to have another health forum. So, sana po
by the way, if you have requests na mga topics, ano, na sa tingin nyo, kasi po, I'm very open sa mga feedbacks eh. Kung may mga request kayo, sige po. Win-win sa akin yan kasi nababalikan ko yung mga notes ko, yung mga tinuro sa akin ng mga mentors ko. Then I will teach, isa-share ko po sa inyo lahat yan. Kaya I really enjoy doing this. Yun nga lang, may mga times talaga po na yung clinic namin, really to attend. Lots and lots of people, especially nowadays, kahit online, kahit offline. Pero you are dear to me, iPartners, kasi meron tayong dalang very important product that can help humanity, you know, not just our Filipino people, pero ang buong mundo. So siguro makita lang ninyo yung challenges kasi po at the end of the day, we will not move, hindi tayo magiging aggressive kung akala natin pareho pa rin ang mundo ngayon. It's not like that, ano. Again, ayoko po talagang nag-inject ng fear sa mga nakikinig sa akin. Pero this is reality, ano? This is real talk. We are very challenged talaga po ang ating health ngayon. And you don't want to na ilabas lahat ng savings mo sa mga hospitals at maubos yung savings mo dyan. Kaya po cost-effective wise, with our community, with our corporate, yung ating company, especially our leaders, talaga pong nasa tamang company tayo with IQMK. Thank you very much. God bless us all.
Okay, thank you, Doc. Talagang we really need this mismatcher up para po talaga maka-prevent kung ano man yung kailangan i-prevent. So, anyone po, wala na po ba talaga mag-ask ng question kay Doc? Siguro talaga.
Baka nagiging malilimutin lang, sir, ha? Kung nagiging malilimutin, dagdagan ang dose, ha?
Yun po, kung nakakalimutan niyo po, ay dagdagan niyo po yung dose niyo everyday.
That's a better strategy, ano? Better advice.
Okay, Doc, sa tingin ko, okay na po talaga sila since they don't have any questions na po yata. Baka siguro po next Saturday with our new topic naman, baka doon po sila mag-ask ng question. And yung sinabi po ni Doc, kung meron po kayong request na gusto i-discuss ni Doc,
yes.
Pwede niyo pong iparating sa amin dito sa office po. Tapos paparating namin po kay Doc Rob para po yung matakal ni Doc or matakal natin sa next health forum po natin. Okay, Doc. So yun na po. I think we're good. And hope to see each one of them again. Kayo rin po, Doc. Ano po, tama po namin kayo. Hindi na po dito sa online. Sana po sa
Yes,
face-to-face. Personal. Marami po magpapa-autograph sa inyo, Doc.
malapit na po,
Kaya,
malapit na.
tanda mo sa sarili mo, Doc. Maraming magpapa-autograph sa'yo.
Oh,
Magpapa-picture.
hindi po ako sanay
Wala po.
nagganyan. Introvert po ako eh.
Meron po tayong version ni Doc Ong dito po sa Health Forum.
Oh, thank you po, thank you. Salamat po, thank you very much.
Thank you po tayo kay partners. Okay, see po again next
Thank
Saturday
you.
po.
God bless us all.
Thank you
Stay
po.
well, stay well.
Pwede po, Doc. Pwede.